You're watching Health Matters. I'm Renee Rouse. Thanks for joining us. Our mission with this show is to give you important information that affects the health and safety of you and your family. In every edition of Health Matters, we cover the big health and safety stories on the Treasure Coast. In a segment we call Health Spotlight, we go out into our community and feature people and businesses making a difference and making the Treasure Coast a healthier place. And lastly, in our health calendar, we'll hear from people and learn about health-related events in our community. Here's the rundown for our first edition of Health Matters. First, flu season is here, and we want to make sure that you and your family are prepared. We'll speak with Maureen Ryan from the Florida Department of Health in Martin County and show you where flu shots are offered in our community and what you need to know before you go out to get one. In Health Spotlight, we'll celebrate Food Day. Peter Schaller introduces us to a Palm City farm specializing in supporting healthy gardening. And in our health calendar, we'll share some helpful food safety tips to keep your holidays healthy. The big story for this edition of Health Matters is flu season. You may be familiar with the symptoms: sore throat, coughing, congestion, fever, achy feeling all over. It's called the flu, and flu season has arrived here in Florida. It's difficult to predict what this year's flu season will be like, so it's best to be prepared and take steps to prevent getting the virus. Influenza is a highly contagious respiratory illness that can cause mild to severe illness. Young children, those with compromised immune systems and chronic health issues such as asthma and heart disease, as well as older folks, are at high risk for serious flu complications. One of the best ways to prevent flu is to get the flu vaccine yearly. Joining us now in the Health Matters studio is Maureen Ryan. Maureen is the Community Health Liaison at the Florida Department of Health in Martin County. Thanks for joining me, Maureen. We're talking about flu season and what the flu is. As we said earlier, it is flu season now in Martin County, so we want to learn a little bit more about what the flu is and what we can do to protect ourselves. So for the first question, what is the flu?
Well, the flu is a contagious respiratory illness caused by the flu virus, which can cause mild to severe illness.
Okay. And we know that that can vary depending on maybe your age or your health condition.
Exactly.
What are some of the symptoms? What do generally we see when people come down with the flu?
Generally, people may run a fever. They might feel feverish, cough, sneezing. They may have muscle body aches, stuffy nose. They may feel very fatigued.
Mm-hmm. You know, it's interesting because when you have flu symptoms, I had always thought that you needed to have a fever. But in fact, you don't really.
Exactly.
Okay.
And that's true. Many people think that, but you don't have to have a fever to have the flu.
Okay, so it generally comes down to these other symptoms. And what should people do if they suspect that they have the flu?
Well, if they suspect they have the flu, they could call their private provider. Mm-hmm. Also, at that point, if they have it, rest, drink plenty of fluids, stay at home, really stay at home so that you don't spread the flu. People are generally contagious a day before they start having symptoms and 5 to 7 days after they start.
Okay, so really the most important thing to do is to prevent, and we talk a lot about prevention. What do people need to know about that? What are the options?
Well, the options would be shots, flu shots.
Yep.
There's also something called intradermal, which is a shot, but it goes into the skin instead of the muscle, and then there's the intranasal. Intranasal has gained popularity over the last several years. People from 2 years of age to 49 years of age can get the intranasal.
Okay, so that's actually like a flu mist.
Exactly. And what the CDC has decided this year, or found this year, is that children from 2 years to 8 years respond very well to the intranasal as opposed to the shot. Mm-hmm. So they're really encouraging children to get the flu mist if they can. Now, if it's not available at their private provider, they state you just go ahead and get the regular flu shot. That's still going to protect them. They just felt like there was that little extra protection with the intranasal.
Okay, and really always the best thing to do is to discuss this with your doctor, because they know best really what would be best for you based on your history and so on. Exactly. And who do we encourage to get the flu vaccine?
Everybody, but most people at risk would be people over 65, children under 2 years of age, and anyone with any kind of chronic health condition.
We do worry about certain populations when we think about flu and complications. Tell us a little bit about that.
Well, as with somebody with chronic health conditions, they don't respond as well. If they have the flu, they could become more ill, increasingly ill. They can have pneumonia, sinus infections, ear infections. And that's why they encourage, also with children, even with the intranasal, they encourage any child or a parent, if there's any child that has any kind of chronic illness, not to get the intranasal.
Okay. And again, the doctor can give the best advice on that.
Exactly.
Okay, excellent. Prevention really is the key. We talk about getting the flu vaccine, but then also there's some other very practical things that people can be doing. Talk a little bit about that.
Absolutely, you're right. The vaccine's the first. Washing your hands, that's a big deal. And also, often, frequently, also covering your cough and your sneeze with your sleeve.
Right.
Those are the main things. Also, if you are sick or you think you're sick, stay home. And don't go to work or don't send your children to school.
Right, that can help stop the spread. It's these simple little obvious tips that just make sense to help hold this all back. So we talked about the vaccine options. Now, as far as going to get the vaccine, you can just go out into the community or go to your private provider. We've seen the pharmacies and even grocery stores offering them, and you don't even need an appointment. You can just get out there, show up, and they can take care of you right there on the spot, because the pharmacists actually have the ability to provide those shots. Excellent. For more information, I think a great source is our website, and that's martincountyhealth.com. People can turn there. They can find out all about the flu season right there.
Yes, exactly.
Thanks so much for joining me.
You're very welcome. Thanks for inviting me.
We're turning now to what we call Health Spotlight. In this segment, we go out into our community to feature people and businesses making the Treasure Coast a healthier place. But first, the bad news. The problem of obesity is growing at an alarming rate, both locally and across the country. According to the latest numbers, 1 in 3 Martin County school kids are now overweight or obese. But there is good news. Peter Schaller introduces us to a local farm dedicated to helping the community grow fresh and affordable food.
There's soil, there's seed, there's water, and there's hard work. But when you visit this family farm in Palm City, you'll find more than that.
So serene and so peaceful. There's butterflies everywhere.
For many people, it's a spiritual experience. They come here, they feel a great peace, and they linger, or they'll return, or want to be involved in some way.
Here at Shadowwood Farm, the Fentons have been growing for 30 years. At first, they sold mostly trees and shrubs. Nathaniel Fenton explains how their business dramatically changed during the recession just a few years ago.
They reimagined the place as an organic food garden.
Now it's a place where families can rent a plot and take home the produce created. It replaces some of the food they need to buy from the store. Sharon Staub lives in Palm City and recently planted her plot for the season.
I've been eating organic for about 5 years, and I heard about this beautiful farm where they grow and eat organic right here.
They thought that places like this vanished from South Florida and Martin County specifically a long time ago, and they remember when there were more places like this available.
In late October, Shadowwood Farm celebrates Food Day. It's the nationwide movement to make our food healthier, more affordable, and more local.
One of the things that we're focusing on doing is bringing those health benefits to people by continuing to try to make this sort of food that is grown within 10 or 15 miles of where people live available.
Food Day is also a chance for families to actually meet the people who grow their food. The Fentons say that relationship is important for people visiting their farm.
There are few things nicer than getting to put a face on someone who makes something for you, provides something for you, because so much of what we do in our day-to-day lives is faceless and impersonal.
Fighting obesity is another important Food Day mission. Here in the United States, the obesity epidemic is expensive. That's because for many people, obesity means chronic diseases. Over 2 decades, obesity will cost our country's healthcare system an estimated $34 billion. A diet filled with fruits and vegetables is a healthy way to fight back. Shadowwood is doing their part one plot and one family at a time.
Those plants, those few plants even, in a very small space, can feed an entire family and more.
The Florida Department of Health has also launched an initiative called The Healthiest Weight. The goal? Bring together communities to help Florida's children and adults make smart choices about healthy eating and exercise. On healthiestweightflorida.com, you can learn about the proven strategies to get to your healthiest weight. At Shadowwood Farm, they're preparing for planting. They're also teaching Sharon and the rest of this class how it's all done.
And the people are so friendly, and it's just beautiful to plant in the earth and see the vegetables just growing right before your eyes.
It's the beginning of another growing season. The farm is enthusiastically starting all over again. But when it comes to cultivating a healthier community, that's momentum that can grow year to year and get stronger with every harvest.
There are families each year, new faces, and that we get to renew our experience with the land and the people of this area with each growing season.
There's more. We also want you to remember 5210. The United Way's Child Health Task Force is launching their 5210 program. It's healthy advice to follow every day. Starting with 5. Eat 5 servings of fruit and veggies each day. Limit TV and recreational computer time to just 2 hours a day. Be sure to get at least 1 hour of physical activity. And lastly, drink 0 sugary drinks. Have some water instead. Now it's time to check in on your health calendar. Many people don't realize that food safety is the most important ingredient in preparing food for the holidays. Here's some helpful food safety tips from the FDA to keep your holidays happy and, most importantly, healthy.
A holiday meal can be challenging to prepare because there are so many foods being cooked at different times and temperatures. It's easy to forget that food safety is the most important ingredient. 4 simple steps can help ensure that harmful bacteria won't be a guest at your festivities. Clean, separate, cook, chill. Clean. Start with clean hands, cutting boards, and utensils. Dirty hands and surfaces can spread bacteria throughout the kitchen. Always wash your hands with warm water and soap for 20 seconds before and after handling food. Clean your cutting boards, knives, and countertops with hot water and soap after preparing foods. Separate. Using the same cutting board for all foods can spread bacteria. Use separate cutting boards for fresh produce and for raw meat, poultry, seafood, and eggs. Keep raw meat or poultry away from raw vegetables and other foods that won't be cooked. And don't put cooked food on platters that held raw meat or let cooked food come in contact with raw meat, poultry, or their juices, because the juices may contain harmful bacteria. Cook. Keep in mind that you can't tell it's done by how it looks. Cooking to the safe temperature kills harmful bacteria. A basic for preparing any meat, poultry, casserole, or side dish is a food thermometer. If you use a food thermometer, you will know when your food is safe and you won't overcook it or undercook it. Find a chart of safe cooking temperatures at holidayfoodsafety.org. Chill. Make sure leftovers get put in the refrigerator within 2 hours of the meal. That includes your leftover pumpkin pie. Keep your fridge at a safe 40 degrees Fahrenheit or below. And remember to use or freeze leftovers within 3 to 4 days. This holiday season, we want everyone to be food safe.
Here's a recap of what we covered in this edition of Health Matters. In our big story, flu season is here, and we want to make sure that you and your family are prepared. For more information about flu season, go to www.martincountyhealth.com. In Health Spotlight, we celebrated Food Day. Peter Schaller introduced us to a local farm dedicated to supporting fresh, local, and organic gardening. And in our health calendar, we shared some helpful food tips from the FDA to keep your holidays happy and, most importantly, healthy. That's all for this first edition of Health Matters. I'm Renee Rouse with the Florida Department of Health in Martin County, where it's our mission to promote, protect, and improve the health of all people in Florida through integrated state, county, and community efforts. Thanks for watching, and remember, health matters.